Well, October is Breast Cancer Awareness Month.
So, do you know when and how often you should get screened?
Dr. Maen Farha with Medstar Health joining us this morning to talk all about this. Good morning.
Good morning.
So when should people start scheduling mammograms?
You know, the recommendations are pretty clear. Women with an average risk for breast cancer should start getting screening mammograms. That's screening mammograms at the age of 40. And it's recommended that's done annually by most medical society, including the Society of Breast Surgery and the American College of Radiology. And now there are some groups who need more intense screening or start screening at a younger age. That's a different story.
And so getting our first one at 40, and then how often after that?
It has to be done really annually, although the Public Health Service recommended every other year. But standard practice in the US and all other medical societies recommend an annual screening mammogram.
And doctor, what are some of the warning signs?
For breast cancer, anytime you have a new symptom that persists, you should have somebody check it. The commonest things patients might complain about is an asymmetry or a mass, changes in the skin, changes in the nipple, redness on the skin that persists, and pain that's localized, especially associated with some redness or a lump, are signs that there's something going on there. Now, we have to differentiate between a screening mammogram and a diagnostic mammogram. Screening are for asymptomatic patients. These are people who have no symptoms. They should get their annual mammogram after the age of 40. But if somebody has a new symptom, they're automatically eligible for diagnostic mammogram, where you focus on the symptom and try to analyze the symptom, get additional imaging. Sometimes you get an ultrasound as well.
And how much does family history impact risk for breast cancer?
You know, family history is very important, but a majority of breast cancer patients do not have any family history. So the fact that somebody does not have family history should not mean, oh, I'm safe, I don't need to get my mammograms. No, that's wrong. A majority of patients do not have family history. A small percentage of the population, less than 5%, will have a gene that increases tremendously the risk for breast cancer. But that's only a small percentage of the population. Probably about 30 to 40% of the other patients would have some family history. But again, the majority do not have family history.
Thank you, Dr. Farha. We certainly appreciate these reminders. We appreciate you joining us.
You are welcome.